Hi everyone, it's Kelvin Nguyen again, and today I would like to talk to you guys about a topic that I'm very passionate about. It's fatty liver. It's such a common issue that literally every day in my clinic, somebody will come in and would ask me, I find out that I actually have fatty liver on my ultrasound, and my primary care doctor referred me to you to talk about it and see something that can be done about it. So how common is it? That's the first question I want to answer for you. So we know that from an epidemiology standpoint, the number is actually increasing. It's now about 40% of people in this country would have fatty liver. And believe it or not, in some areas in the country, it will go up to 50%. Terrible, right? I mean, why is that on the rise? We think it's a combination of different factors. It could be environment, it could be genetics, it could be the food that you eat, it could be the diet, the environment that you're in. You don't exercise very often, the lifestyle that you have. You know, you have a sedentary job that you just sit down all the time. So for that reason, it could be many people of different groups would be at risk for this. How do I find out I actually have fatty liver? Well, first off, you need to have some kind of risk factor for it to kind of ask your doctor to check it for you. We know that metabolic syndrome, which is basically a whole host of different diseases that put together, high blood pressure, high cholesterol, diabetes, these tend to go hand in hand with fatty liver. So if you're at risk for any of those diseases that I mentioned about, you should ask your doctor, just, hey doc, I want to get an ultrasound of my liver just to make sure I don't have fatty liver, because I know how common it is now. So now, if you diagnose with fatty liver, then what's next, right? I just said 40% of the population might be at risk for it. However, not everyone would be having an issue with it. Among those, about 20 to 30% would have inflammation from the fat in the liver. And so, would I feel anything if I have inflammation in the liver? The answer is no, you probably don't feel anything. I mean, it's very early on in the disease process. All you know is that my liver test is high. So you should ask your primary care doctor if they actually check the liver function test for you to look if there's any of these liver enzymes being leaked into the bloodstream that they can check it for you. If it's elevated, then you know you have inflammation from fatty liver. Now, the next step is, usually in the process of the workup for fatty liver, I tend to do a few other blood tests to rule out other diseases before I commit to fatty liver. Back in the days, we tend to do a liver biopsy to see the severity of the disease, as well as seeing any scarring or fibrosis going on in the liver with the fatty liver. But nowadays, we don't have to. We try to go into a non-invasive process to figure out the mortality rate, as well as kind of stratify where we are in the disease process. So there is a thing called Fibro Scan. So Fibro Scan is basically a technology similar to an ultrasound, but it's a little bit different. An ultrasound, you look at the anatomy of the liver. Fibro Scan is focusing on the stiffness of the liver. So every time that my nurse actually used the device and pressed the button, each time that she pressed the button, right next to the liver with the probe right there, that would be a sound wave that will come out and hit the liver and returns back to the device 10 times. We get a number. With that number, we actually can tell you how scarred it is in the liver. 2, we can even tell you how much fat actually stored in the liver as well. So it's actually very helpful information to quantify the amount of fat for you, as well as telling you where you are in that spectrum of fatty liver. So now that you know you have inflammation from the liver, what else can be done for you besides, you know, doing some blood tests, doing some ultrasound, doing some Fibro Scan? Now let me tell you. So I mentioned to you about metabolic syndrome, right? So that's including high blood pressure, diabetes, high cholesterol, obesity. So those actually needs to be controlled as well, along controlling or taking care of the fatty liver. It's so important. So we know losing weight would help with all the other conditions, right? You go to your doctor for high blood pressure, you need to lose weight, you need to change your diet. You have high cholesterol, same thing. Lose weight, change your diet, exercise. And that will go pretty much the same for diabetes as well. And so with fatty liver, we do recommend that. And it's not that we just recommend it just because for the sake of it is. Research actually have shown that if you actually can lose 10% of your weight, that would help to kind of reverse the process of cirrhosis to fibrosis, or the level of fibrosis can be adjusted over time. So I usually set a goal for my patient, trying to lose about 10% of your weight. Say the patient is about 200 pounds, so you want to lose say 20 pounds. How long? Well, 6 months to a year. I kind of gauge with the patients and see like there is a very active person or not, or there is someone that actually have a very kind of sedentary lifestyle that basically you want to see if the patient can accomplish that task in a certain amount of time. You don't want to do it like you don't want to ask say a very kind of slow patient to lose like 20 pounds in 6 months. It might not be even feasible for some people if the only activity they do all day is just basically walk around the park like once a day, and that's it for them. So it might be tough. So you want to set the goal a little bit more realistic, so that way then they feel like it's something doable. And that's really very important. And we set a goal that way because we're gonna check in with the patient periodically and just basically and see where they are in that process. So losing weight, that will help. Taking care of all the other risk factors, that will help also. What else can be done? Well, there are a few other medications that we can use. Vitamin E, for example, I use that in some of my patients when I'm just literally so desperate for taking care of fatty liver, and I know the liver enzyme has been high for so long. And when it's high for so long, guess what? Yeah, you don't feel anything. Sure, I mean, you run a blood test, you see a little elevated blood test in the liver, but is that important? Yes, it is, because if we don't take care of it now, 12 years from now, 15 years from now, 20 years from now, you will develop liver cirrhosis. You don't want that. Liver cirrhosis is basically end-stage liver disease. Your liver is basically doesn't have any more normal tissue. It's gonna be filled up with scar tissue and it's not working anymore. And when the liver is not working anymore, toxins gonna build up in your body. You're gonna start developing yellow eyes, yellow skin. Your belly is getting bigger because it's filled up with fluid now. Your legs getting swollen. Men, having big boobs now. Not the type of boobs that you want. And you can have big testicles too. And again, this is just like from swelling. Basically, the fluid is actually not being returned back to the liver and create this kind of swelling scenario. And definitely you don't want that. And because the next step, and I say this to all the patients, if you have cirrhosis already, the only treatment at this point is liver transplant. And as you know, not everyone would be lucky enough to have liver transplant. Some would die before they actually even qualify for it. So it's pretty sad, and you don't want to wait until that point. If you actually know there is an issue now, even though as quiet and silent as it is, if you can take care of it, do it now. So losing weight, taking care of all the other risk factors if you can, and of course, also talk to your family. We do believe, there is a genetic component. Some of the drugs in the pipeline right now, basically trying to target these kind of genetic markers or genes that might be involved in fatty liver. So very important that we kind of look at not just one small issue, but we look at the whole big picture. Again, metabolic syndrome, fatty liver tend to go hand in hand. And last but not least, I want to point out one thing. I have a lot of young Asian female patients that come to me and basically say, no way I have fatty liver. I mean, look at me, doc. I mean, I don't have any fat on my body. My BMI, my body mass index is like 20, and I'm super skinny. My friends always say that I can eat anything I want. There is no way I will have fatty liver. Wrong. The problem here is, genetically, some of the patients actually wired to have fat distributed to the liver instead of to the muscles. So you will see fat in the liver, but you don't see fat in the muscle. And that's actually a bad thing, because now you don't have that kind of radar to kind of look out for fatty liver. and even harder for a doctor to convince the patient to do something about it, right? Like these are young patients who basically have no other risk factors that I mentioned to you. And then how are you gonna convince them to lose weight? They're already skinny. There is no way they're gonna lose more pounds for you. So the best part in this situation is basically tell them that, you know, you have to change your diet. You cannot have that mentality that you can eat anything you want. You're gonna pay for it down the road and you don't want that. So again, this topic is something I really keep it close to my heart because I see the consequence down the road, and I want this to be echoed to every single patient that I deal with every day, and do something about it now because it's so important and we know it's on the horizon to become an endemic. It's beautiful here, believe it or not. I'm actually outside the library next to a park. Right after work. You see that? Well, I love wearing scrubs, but this is the outfit that I was wearing at work today. And guess where I'm going next? I'm actually going to the gym. So maybe I will see some of you guys there. Try to, I'm trying to take care of my own liver. I don't think I have fatty liver. I already Fibro Scan myself. I don't have fatty liver, which is great, but I want to maintain it that way. So, so keep it up. So maybe I will see you guys over there at the gym. And ciao for now, and we'll see you at the next episode. Alright, you guys have been watching my YouTube channel, Dr. Kelvin Nguyen. If you really love what you're seeing, please subscribe to me. You can do it for me, or you can do it for the ducks in the background. They would love to see you at the next episode as well. See you next time.